Welcome to the Menopause and Cancer podcast, where we speak with cancer patient survivors and incredible doctors in their fields to help us find solutions to our symptoms, but also ideas to improve our health. My name is Danny Binnington, and today I want to be answering whether collagen is safe for you to take as a supplement once you've had a cancer diagnosis. I am joined by the incredible Dr. Nina Fuller Shavel. Nina has more degrees under her belt than any other doctor we've had on this show before. Nina has been a podcast guest before. She has supported our work and she is absolutely incredible. She's an integrative oncology doctor. And if there is anyone to answer this question better than Nina, then please send them my way, because I do think Nina is the absolute best at helping us really figure out what all of our true integrative options are when it comes to managing cancer survivorship holistically and with an integrative approach. And collagen is one of those things that comes up all the time. Is it safe for me? I heard there are links to cancer maybe growing when you're on a collagen supplement. So many people say it's amazing for their skin and their joints. And so we hear a lot of different stories out there. But is collagen safe or not is what I want to find out from Dr. Nina Shavel just now. Welcome back to the podcast, Dr. Nina Fuller Shavel. How are you today?
I'm very well. Thank you for having me back, Danny.
I want to have the only conversation to really answer this very difficult question for everyone out there. Can we safely take collagen if someone has had a cancer diagnosis, if we want to aid our menopausal symptoms?
Well, the question is very difficult because we actually don't have enough evidence at the moment. I think there's been a lot of scaremongering around collagen that we do need to address. And that's because when people read the research around collagen, they mistake the tumor collagen for the collagen that we'll take orally as a supplement, for example. So collagen in the tumor environment is actually changed by the different tumor cells. So it's a bit like when cancer gets established, it looks at the house around it, which is a tumor environment. It goes, I don't like this house. I want it to be nicer for me so I can continue growing. And so what it does, it co-opts the decorators, and these are the immune cells and the connective tissue cells within our tumor environment, such as macrophages, the immune cells, and the fibroblast. So it calls these decorators in and goes, redecorate this place for me, thank you very much. So then those poor macrophages and fibroblasts go off and they actually change the collagen environment. They break down normal collagen and they lay down pro-tumor collagen. Now, that process happens independently of any collagen that you eat. It is an entirely tumor-driven, cancer cell communicating to its decorators kind of affair. So when people kind of talk about collagen, they get that confused with the collagen we're actually eating or drinking or supplementing. And that's an entirely different thing. So one thing happens within the tumor and is driven by the cancer cells themselves, and the other thing is completely unrelated to oral intake. So from the mechanism perspective, there is no direct link between the two. And so there is no evidence that it would actually do harm to consume oral collagen because that doesn't affect the tumor microenvironment. We have no evidence of this direct link effectively. Having said that, we also don't have really great studies in collagen in people who have had a cancer diagnosis, following them up for a long period and saying it is safe and it is effective for different symptoms, etc., etc. Because all of the collagen studies so far have been done in people who are generally healthy or maybe have some degenerative joint problems or maybe menopausal women who are suffering from loss of skin elasticity, etc. But there have been no specific people either during cancer survivors period or during in-treatment trials. And that's kind of where the problem is because people are hearing all sorts of sound bites. And the answer is we don't know, but there is no evidence for the scary link that's out there on social media either.
Okay. And now as a patient, I'm thinking, well, what do I do with that? And that's where you are so perfect to sort of help me mull it over. Let's go back to the basics. And where and when did people realize that additional collagen as a supplement might be helpful for a variety of our symptoms? I'm sure many patients come into you and into your consultations and they want to talk about collagen. So when is it helpful? Let's talk about that a little bit. And then also different types of collagen.
So in terms of when it might be helpful, the research so far in non-cancer populations is strongest in terms of joint health support and skin health support. So they're the two things that normally people come to me in clinic and say, you know what, actually, be having some joint symptoms, already maybe have a bad knee because I've been a long distance runner. I've had it was good for that. So can I take it? Or the other side of things is we know menopausal symptoms, particularly early menopause, the skin texture changes quite significantly. People talk about skin elasticity and not wanting to feel that way. So then we discuss the pros and cons from the skin perspective. So while there are trials and other conditions, I would say they're the two things that are probably I hear the most commonly in clinic overall. In terms of collagen types, I think you mentioned, bovine and marine are the key ones. So really something that's derived from cows or something that's derived usually from fish. And the vegan collagens in the market are not actually collagen. So they are just cofactors that may support collagen production because there are no plants that have collagen. So you cannot take a plant collagen that contains collagen.
Okay. And so the symptoms you've mentioned are actually really crucial symptoms to be addressed. We know so many people who are on long-term endocrine treatment, joint ache and pain can really stop them in their tracks. And of course, our appearance is important because we already feel out of all sorts. Many people do after a cancer diagnosis, then your body changes. And then a few months later, your skin changes and you think, oh my gosh, is this just going to go on? What else is going to change? And so it's important to address that, isn't it? How else can we address these instead of a collagen supplement? So what I'm trying to think is if I didn't want to do the supplement, what is the collagen actually? Like, what is it? I know you said it comes from animals, but what is it?
So collagen is actually part of your normal connective tissue. So if you look at your skin right now, literally look at your arm, okay, a lot of the skin will be made from collagen, actually. It's surrounding all of our cells. So all of our cells don't sit in just a ball of cells. They sit in a surrounding tissue. So think of it as a soil of a garden. You know, your cells are like little plants, but the collagen would be part of that soil, okay? So it is a protein that is basically surrounding many of the cells in the different tissues. And some tissues have more collagen than others. So depending on what tissue you look at, there's different proportions. And what I would say, I guess, from the clinical perspective is when people talk about these problems with me, is that we do suggest collagen supplementation as a trial, because if it helps improve people's symptoms, it is worth doing. Then we very carefully monitor for safety. And what I would say in clinical practice over the years, I haven't seen a safety signal. But I do need a bigger trial to be able to actually talk to people and recommend it. But we discuss the pros and cons. So we'll talk about what does the evidence say for, say, skin or joint symptoms for the collagen side of things, and then what we don't know. And what we don't know the long-term safety of this stuff, to be honest, in anybody, because nobody's done a good long-term trial. But if it's worth it for people for the relief of symptoms, so we'll certainly trial it and we monitor it carefully. And in terms of joint and skin symptoms overall, I mean, there's multiple things that we should be doing, and I never recommend any single intervention. As you know, my whole point is to make sure that all our nutrition, physical activity, sleep, psycho-emotional well-being, and other things are taken into account, because the human body, including the joint symptoms, are so much more complex. If you have an aromatase inhibitor and you're suffering with joint pain, you're much more likely to get a higher severity, but also get fatigue and sleep disturbance if you're inflamed. So giving you collagen is not going to manage that inflammation. It might actually symptomatically improve some pain, but the cleverer bit would be not just to do a symptomatic intervention, but to tackle the root cause and reduce the inflammatory markers. And that's where it really does become very individualized for what we do with people, because it depends on what medications they're on. It depends what exact symptom severity, what their blood biomarkers tell me, because I do want to make sure we've done a deep enough dive into somebody's physiology so that we are recommending the right intervention. It isn't ever one size fits all, as we know, for anybody. So it's making sure we do the right thing for the right person at the right time.
Mm. When you talk about a collagen product and you say it comes from animals, am I eating parts of this animal as when I take a collagen supplement?
Pretty much. Yes.
That's gross. Yeah.
Well,
okay.
Every time you have bone broth, I'm afraid it's the same thing. So it's a dietary source of that. So I'm with you. And I think, again, when we're looking at the fish supplements, it would be derived from fish parts. Yes, absolutely. Yeah. Now, when we if we are fully plant-based, of course, that's why we have this proliferation of these vegan collagens on the market. They're not real collagen, but they're cofactor amino acids and other supporters that can they hope will generate a collagen supporting effect in the person. Again, how well some of these work, we need clinical trials to actually say they do what they do. And vast majority of the brands out there that provide vegan supplements don't actually have a clinical trial behind them. So it's a tricky situation. But I always talk to people about what would you like out of it? Do you want to just work on the dietary side and just make sure you've got enough protein in the diet? Do we want to make sure we work on the fatty acid balance, because that affects the quality of our skin as well, and the way our skin is maybe drier or maybe better moisturized? So there's multiple things that we can do. Like I said, if you find that whole concept gross and you really you are maybe a pescatarian or a vegetarian or a vegan, then this is probably real collagen supplements are probably not for you then at that point.
And if I want, so when you said the collagen is basically a protein, does that mean if I have an egg or two or a chicken breast or a piece of salmon, it's the same as having a scoop of collagen powder? I'm really trying to figure out here what's the difference between the collagen and what I might eat. What's the difference?
There is a difference. So the difference is that actually, if you're looking at a normal protein consumption, not something that's specifically high in collagen, which is normally means something like connective tissue, which is like, sinew, that sort of stuff, that's quite rich in collagen. So if you just take a normal, effectively muscle, which is what we're eating, if we're eating a chicken breast, we're eating effectively muscle tissue, right? From that perspective. When that hits your digestive tract, will actually get digested into amino acids. And that's the stuff that's going to get absorbed. Now, collagen actually will get absorbed into these peptides effectively. So what you see is there's small chains of amino acids, okay? And that's what the collagen peptides are. They will get absorbed, usually whole through the gut wall, rather than being absorbed as little amino acids. So there is a difference, because a collagen peptide is a much longer chain of amino acids that is actually can get through and can get into the bloodstream and then go and get deposited in the right way. So you don't get an equivalent between just having a bit of chicken breast. But actually, if you boil some of those more like connective tissue, like bone broth, that is what we see is probably richer in natural collagen. That's usually when you extract more of those peptides from the gelatin as well. And that's why bone broth has become popular, is because it's sort of connective tissue boiled down is a little bit richer in some of those gelatin and collagen peptides effectively.
Now, I know no one is interested in how I eat, and I know you're not interested in how I eat, but I'm going to ask this question. I am mainly vegetarian, and I sometimes have a bit of fish, and I don't want anyone to give me a label or a box of what I am. I've tried loads of different things, as you know, but that's how I eat at the moment. So I wouldn't consume bone broth. I wouldn't consume red meat or anything with connective tissues that you've explained. So does that mean my normal diet would be lacking in collagen as a vegetarian? So
definitely be lower in collagen. Yeah, it would definitely be low in collagen. Absolutely. So that doesn't mean you can't make your own. So that's important, is those amino acids that we have individually that we absorb from normal protein. Your connective tissue should be able to make your own. Otherwise, we'd all have to be on consuming regular amounts of collagen. So your body has a way of making its own collagen, okay? It does. We give it an extra bit of support if we provide some of the ready oral collagen sources. Mm-hmm. So it's not like your natural diet will be low in collagen, provided it has enough amino acids of the right kind, you will be able to make your own collagen in your skin and in your connective tissues. Okay. Does that make sense? As long as you give it enough source for the fuel, you can still make a fire. But you could actually, if you put in a fire lighter, you might be able to make a fire a little bit more easily.
And you're busting so many myths, because I've had conversations on the podcast where people say if you eat enough protein, that's as good as having collagen powder. But there are all these subtle differences that you're just explaining. And I have tinkered with collagen in the past, for example, and the first place it went to was my nails, for instance, in my particular body. And so I wonder, when someone supplements with collagen, does the collagen it doesn't go into everyone's joints? Does the collagen chooses where it goes to? Because when I speak to people tell me different benefits. And so I'm scratching my head all the time thinking, why is Claire saying it's good for her skin and Josie's saying it's amazing for her joints? Like, how is that possible?
Good question. I don't think we figured out the mechanism for it, but the idea is we think, and again, this is a massively nebulous theory, is that there maybe is wherever there is stress in the body is good at directing resources. Okay, so we are really clever. Like, for example, with exercise, the body will direct things to our muscles to be able to enable repair and all of that sort of stuff. So the idea is that, or the theory, which we haven't worked out any of the detail of, is that wherever the body is most stressed and it requires building blocks, those building blocks can go there. So a little bit like the joints are your vulnerable part, and actually there is some inflammation and we are getting some grating in terms of bone on bone. The body will be calling for ways to soften that. So it'll be trying to repair itself constantly. Or it might be that the deficiency is mainly in the skin, or we're struggling with collagen production in the skin. So this is why everybody's getting different effects. It's probably the differential stress is how I describe it, depending on where the body is stressed in different ways. How it happens, I have no idea. And to be honest, I've never read a convincing paper that tells me exactly how that signaling works. How do we call for it? How does it get deposited in the right way? And that's a tricky thing. And I think in terms of the controversy about collagen, not to collagen, if you're getting enough dietary amino acids, you will make your own collagen, but it doesn't mean you're going to get the same benefit as supplemented collagen in all cases. So if you've got degenerative joint disease, or if you've got skin problems, you may be eating a good protein diet, but you may not necessarily be getting optimal amounts of collagen in. So it's just about, it's a bit more nuanced to say, yes, everybody will be able to be fine on just normal protein diet. There's little bits and pieces. It's about saying if somebody needs more help, it's a little bit about like somebody B12 deficient and you are B12 sufficient. You know, you and I will need different things if I'm B12 deficient. I will need more B12 than you do, for example.
Yeah.
Same thing is if I've got joint symptoms, I will need more support for my joints than you will, even if we're eating exactly the same amount of protein per kilogram body weight that you and I are doing at the moment.
Yeah.
So everything depends, basically.
Yeah. And is there, so if people are on maybe active cancer treatment, would collagen, would people have to mention to their doctors that they take collagen, do you think? Let me just interrupt this conversation very briefly. I know I've mentioned joint ache a couple of times on this conversation, but I wanted to reassure you, in 2 weeks' time, we've got a whole specific joint ache episode coming out onto the podcast. I'll be joined by the brilliant Dr. Melanie Hacking and the fabulous Dr. Suzanne Hooper. Both of these ladies are brilliant menopause specialists at the Oxford Hormone Clinic. They've got a real passion and interest in helping people with a history of cancer. And they've said to me, Danny, joint ache is such a huge issue. Let's do an episode on it. And so I can't wait and can't thank them enough for their expertise. Look out for it in a couple of weeks' time. But also a huge thank you to the whole team at the Oxford Hormone Clinic who have also helped me get this podcast episode out to you. So they financially contributed to the podcast, to all of the editing services and everything that goes with it in producing this podcast for all of you. And I can't thank them enough for wholeheartedly and completely supporting all of our projects and hence all of our community. So thank you to the Oxford Hormone Clinic. I'm going to link to them in the show notes here. And if that episode sounds interesting, then tune in latest a couple of weeks' time.
Yes, I think, to be honest, any supplements at all should be mentioned to your treatment team and should always be checked. If you've got a nutrition professional on board as well, or your integrative doctor, they should all know about what you're taking. Your conventional medical team should also know what you're taking. It's important because there may be interactions or there may be some reason or another why you shouldn't be taking something. Vegan collagens often have very long lists of supplements in terms of ingredients. So if you look in the back of one of those, you will normally see at least 8 to 10 different ingredients, all of which could potentially interact. Somewhat easy like amino acids, but sometimes things are added like, additional herbs are added to some of the things, antioxidants are added quite often into collagen supplements, and antioxidants and during oxidative chemotherapies are contraindications. So having maybe a platinum chemotherapy and then receiving low-grade antioxidant supplementation beyond food intake, most oncologists would worry about that because they wouldn't want to knock off the chemotherapy effectiveness. So anything that you take at any point during treatment or in survivorship if you're on long-term medication should be known to your medical team. It is important.
I can imagine that there are thousands of people listening to our conversation now who are on long-term cancer treatment, like aromatase inhibitors or tamoxifen, or in surgically onset menopause and they're not on medication, but really struggling with joint ache. And they're thinking, actually, maybe I should try collagen, or maybe it might help me. How do we help people? How do we empower people that they can go explore things feeling safe, but also thinking, well, if this works or not works, do I carry on? Do I stop? Do you know what I mean? I feel like it's too much to ask of everyone now to try and find a doctor who can guide them. And I know lots of people want to try things out themselves. How do we help them make that decision? How could we counsel them, really?
So I would say the first thing to do is, if you're considering of adding any supplement, including a collagen supplement, to your routine, if you can't get hold of your doctor for whatever reason, maybe you're off active treatment, go and speak to a pharmacist and say, look, this is the product I'm thinking of taking. These are my medications. Could you please help me with any of the interactions? So it's pharmacists, in particular oncology pharmacists, are a fabulous resource that is horribly underused, and they're amazing at being able to spot interactions and counsel you. If you want to have a discussion with your doctor, also come empowered with some information. So you can use one of my collagen blogs, for example, as an idea of explaining the difference between what's collagen in the tumor and what's collagen that you're taking. So that becomes an important thing to do. And I think that's an important conversation. If you want to try things out for yourself, the key thing is the interactions. As long as an oncology pharmacist tells you, from my perspective, there are no interactions, you can trial it. And if you don't see the benefits, after 6 to 8 weeks of use, if you don't see by that point some things start to change, I don't mean necessarily the full effect, but usually some things should start to change after 6 to 8 weeks. Then at that point, it might not be the right intervention for you. You should probably stop and try something else. And if it's something persistent and severe, like if the joint pain really is persistent and severe, then do seek further support. Don't just rely on a single supplement to manage it. There's multiple ways in which we can do that. And there's the good integrative oncology pain guidelines, again, that we should look at for aromatase inhibitor-induced arthralgia, which highlight things like acupuncture, for example. As I mentioned, the inflammatory markers make a really big difference to people in managing those. So in terms of empowerment, I would say if you're up for doing collagen, then speak to a pharmacist or your medical team. Once they give the okay, you can give it a trial, 6 to 8 weeks. If you're not seeing any of the benefits, then actually it's not worth investing your money into. We should probably find other ways of solving whatever problem you're taking this for. And I think you probably saw an effect, like I said, on your nails pretty reasonably quickly. I would say probably within 4 to 6 weeks?
Oh yeah, within 4 weeks I sort of noticed the nails, but then I kind of, although I saw the benefit, I kind of stopped again because I was a little bit worried, thinking, I'm not sure, are there contraindications? What about people with cancer? And the crazy thing is, Nina, at the time I was many years on from my cancer diagnosis, but because of these rumors or myths, as you described them, circling around the internet, I then became a little bit more worried again. And then I stopped. And then when my interest spiked again was when I did sort of get grindy hips, like annoying, a dull ache, and just not really pain, but just feeling a bit of that grinding, sort of irritated hips, really. And then I thought, wow, maybe collagen. So my thoughts went back to maybe collagen. But because I'm always obviously the cancer survivor, like so many people on the podcast, I'm mulling over the same things as everyone else. Should I not? Where do I go for trusted information? And it's really when I found an article you wrote about what we do know and what we don't know that I thought, actually, I must try. And that was over 8 months ago. And it's taken me that long to get you back onto the show. Can I just say that I thought, actually, I really want to explore that and find out once for all and have this episode on there. To empower myself to maybe go for it again and not feel so worried, and see if I find benefits now, and maybe everyone can mull over in their own little way what they want to do with that information. And I know I need to do a bit of research into brands. I know I really don't want to take anything that comes from fish. That's a bit yucky for me. I don't know. Maybe also that is going to influence me what I'm going to do. And since this is how beautiful we all are, isn't it? Some people might not mind that it comes from animal at all, and some people will be bothered by that. And so we're all making decisions based on lots of different personal reasons, aren't we?
Absolutely. And also the key thing is there's always a toolkit, and there's a wider toolkit beyond collagen for anything from the hip perspective. And in fact, if I was in clinic with you, I'd probably be exploring things like Rosehip, for example, something like the GoPost standardized rosehip extract has actually been clinically shown to reduce the amount of joint pain in people with just general chronic joint aches, but also things like osteoarthritis. I get a great benefit from it for people in clinic. My husband derives great benefit from his terrible knee with the ACL reconstruction. And so, again, if you're thinking about levels of evidence and what we might be slightly cautious of, again, I just don't want people out of desperation to be necessarily pushed out of their comfort zone. I'm comfortable taking collagen. I'm a breast cancer survivor, HER2 positive breast cancer, but that's because I said I've done my own risk benefit. For me, it's okay. But if you're ever feeling unsure, I think the important thing is to never push yourself out of that comfort zone. There's actually vegan collagen data is pretty poor. So would you be better off taking something, considering, provided there's no interactions, like Rosehip that has a clinically proven effect, and it is a complete natural substances, plant-based. So I would always encourage people to do a bit of your own research, think about what is important to you, and also never just grab for the popular thing. You might find that something else suits you better, and I think that's important.
Yeah. And don't go for all these things that are heavily advertised, right? At the moment, I think because I was preparing for today's conversation, Facebook and Instagram, they're chasing me. I swear every time I open my phone, I've got another collagen brand sort of shouting at me going, buy me, buy me.
But also the amount of additives in some of these things. And to be honest, if somebody were to go for collagen, I would just get pure powder that has very few ingredients. It's really important because the amount of additives and the liquid collagens in particular, they have to stabilize them. So the amount of stabilizers or sweeteners or preservatives that go into these things, you're like, I like things as pure as possible. I'm a purist anyway because it makes my interaction checking easier, but also I don't want to put anything in my body that doesn't belong there. So if you take a collagen liquid and you look on the back of it and you go, I can't pronounce this ingredient, your body can't either. So don't bother. Either go for kind of a reasonably pure powder that you can stir into water, drink, a smoothie, something along those lines that doesn't have loads of stuff added to it. But a lot of the liquids, I would just caution people, they do have a lot of additives in them and usually artificial sweeteners as well. And so probably would on the caution side and steer away from that.
That was a great last tip. Thank you so much. And I can't wait for everyone to go off and do their research off the back of our conversation. Thank you, Nina.
Thank you, Danny.
I like that tip, powder over a liquid collagen, isn't it? There's so many great tips in this conversation. I think one of the biggest takeaways from talking to Nina for me was that one thing alone isn't ever going to be the thing and that helps you the most. And I agree with that so wholeheartedly because I speak to so many of you and no one said to me, Danny, if you just did that one thing, then that would be amazing and all of your symptoms will go. It's a multifaceted approach that we need to work on. And I think if we all can explore a little bit more about what our options are, what we want to do, then truly that I think is truly empowering. So let's go out, let's do our research. Let's enjoy our collagen or not. And I can't wait to chat to you on the podcast next week. I'm going to link to everything in the show notes here, any resources that Nina has shared with me. Chat to you soon.